I think the way forward for the country as a whole is to continue with the path that we're on. We'll keep everything under review. Of course, we keep all measures under review, but the mixture of things that we're doing at the moment is, I think, the right one. So number one, continue with Plan B. Make sure that people take it seriously, do what we can to stop the spread, use the Plan B measures, work from home if you can, wear a mask on public transport, be sensible about take a test before going out to meet people you don't normally meet, think about the requirements under Plan B, but also get the booster. And I think that's the difference between the UK and so much of the rest of Europe and perhaps the rest of the world. We have a very, very high level of vaccination now, and we need to continue very fast to build up those defences and that protection in the population. About almost 34 million people, 33.9 million people across the UK have had a booster. Amongst the 70 to 75 group, you're looking at over 90% of people have had it. Huge numbers, I think 76% of adults. 76% of adults. So everybody who's thinking about it, get a booster and you're joining the vast majority. I think we've got to recognise that the pressure on our NHS, on our hospitals, is going to be considerable in the course of the next couple of weeks and maybe more, because there's no question that Omicron continues to surge through the country. A third jab really does make a big difference. There are 2 million slots just this week to get your booster, so get boosted now. It can make all the difference in the world. The majority of people who are in ICU, sadly, have not been vaccinated, and certainly the vast majority, about 90%, have not been boosted. We'll continue to look at the infectivity periods, but the key thing is we don't want to be releasing people back into the workplace when they're still infectious. And the risk is you'd increase the numbers of people going back into the workplace who are infectious by a factor of 3. So you might perversely have a negative effect on the workforce, if you see what I mean. So that's the argument we're looking at.